Hello everyone, in this video we are going to discuss about part 2 regarding glomerular nephritis. Okay, in this especially we are going to discuss about clinical manifestations for the glomerular nephritis. Means in the hospital many of the children will comes because some mothers or complain some problems. Okay, many of the children as like patients, okay, the mother will comes to the hospital, my child suffering with these problems, these symptoms, okay, many of the one or more symptoms they are complain. As a nurse we are listening and we are differentiate that particular symptoms. Okay, symptom based we are differentiate, the child will be suffering with the renal system problems or respiratory system problems or digestive system problems or endocrine system problems. How we are differentiate means when we are not having the theoretical knowledge perfectly, means then only we are differentiate the child will be suffering with this type of disease condition. Okay, that's why we have to learn in detail about these conditions. Okay, first of all we are learning or we have skillful knowledge on the topic, means then only we are providing prompt treatment to the children. Okay, in this what are the glomerular nephritis symptoms? How we are differentiate the child only suffering with the glomerular nephritis, means depending upon the symptoms. In these symptoms especially the child will be having the one symptom like decreased urine output. Okay, the urine output will be decreased, means in a day some measurement is there for the children. Okay, in the children's this ml of urine should be formed and excreted by the children. In that the normal level of urine should be excreted, means the child will be having no problems. But whose children having the low excretion of urine, means the child may be suffering with some renal disorders. Okay, like that we have to decide the child disease condition. Okay, in this first symptom decreased urine output. Okay, next one is when we are assessing the urine having some type of blood clots or sometimes brown colored urine. When we are assessed the urine, in that normal there is no color of urine, but in this the children who are suffering with the glomerular nephritis, those children excreted urine, means in that urine brown color, sometimes blood clots, some blood combined will be there in that urine. Okay, this is the second clinical manifestation. Next another one is the Peri-orbital edema in the morning. Okay, when we are assess the child, okay, in the morning, especially in early morning, Peri-orbital edema formation. Okay, in that around the eyes. Okay, around the eyes the child having some fluid accumulation, edema formation is there. Okay, this symptom also identify whose child having the one disease condition, that is the glomerular nephritis. Okay, next another one is the child having the rapid weight gain. Okay, within short period increase weight. Why? Because there is no body not excreted waste products. Okay, which is the waste fluid is there. The fluid cannot excreted from the body. All fluid will be retained in the body. That's why the child will be having the excessive weight or rapid weight gain. Okay, next one is the child having the common symptom like malaise or mild headache. Okay, next another one is the GI problems also there. In the GI system problems like the child, some children are not having the good appetite. Okay, they are having the loss of appetite. Some children are having the vomitings. Okay, the children, some members are not eating well, some children are eating and vomiting. Okay, they are having good appetite, but the food should not digested. The food should be vomited or backflow. Okay, another symptom like hypertension. Okay, when we are assessing the children's blood pressure. Okay, the blood pressure should be increased than the normal. Okay, this is the clinical manifestations of children who are suffering with the glomerular nephritis. Okay, next one is the diagnosis. Okay, in the diagnosis what we are doing means especially the children are suffering with the history, this type of problems, how we are differentiated means by collecting the history. Okay, baseline data, what is your name, what is your age, okay, what is your occupation, or what is the major health problem. Okay, regarding that we have to collected history from the children's. Next, another step, that is the physical examination. In that especially we are identified by doing physical examination, we are decided one symptom like periorbital edema. Okay, next in that we are assessing that especially urine examination. Okay, in that urine examination what we are identified means especially in that urine contains some amount of blood or brown colored urine. Okay, sometimes the child urine blood urea nitrogen level should be increased. Okay, when we are examination of urine of the children, blood urea nitrogen levels also increase. Okay, next another one is the erythrocyte sedimentation rate. Okay, in that the ESR rate will be increased. Next another one is the when we are assessing the children, the potassium will be increased. Another one is the sodium will be decreased. Okay, sodium concentration decreased, potassium concentration increased. Okay, next another examination like when we are assessing a microscopic examination of the blood. Okay, the RBC count should be decreased. Why? Because there is no proper purification of blood. Okay, there is no normal process, that's why the RBC will be decreased. Next when we are assessing the WBC count also decreased. Next another one is the sometimes the child urine contains some pus cells. Okay, the child urine contains some pus cells. Another one is the we are doing the chest X-ray. Why? Because some infection will be spreading from the lungs to kidneys. Why? Because if the child will be suffering with the any lung infection, the lung infection mainly caused by the streptococci microorganism means it will be easily circulated through the blood from the lungs to kidneys. Okay, next another one is the throat swab culture. Okay, we are collecting the some throat samples by doing the throat swab culture. Okay, for assessing the which microorganism is there, especially streptococci is there or remaining or other organisms will be there. Okay, that will be identified by doing the throat swab culture. Okay, these are the diagnostic procedures regarding glomerular nephritis. Okay, next we are going to discuss about medical management. Okay, in that medical management what we are doing means especially we are administer the antibiotics for prevention of infection. We have to administer the diuretics for reduce the edema formation in the body, for improving excretory system or excretory functioning of children. Okay, that's why we have to administer the diuretics to the children. Okay, next another one is the we have to administer anti-hypertensive drugs. Why? Because the child shows one symptom, that is the hypertension. Okay, the BP will be increased. For maintenance of normal blood pressure, we have to administer the anti-hypertensive drugs to the children. Okay, next another one is the we have to administer, that is the sedatives, and we have to give symptomatic treatment. Okay, for example, vomitings is there. For control of vomitings, we have to administer the andamstiron anti-emetics. Okay, for example, the child having the loss of appetite means for improving appetite we have to give some health education. Okay, small frequent of meals we have to take, many times we have to take the food. Okay, like that we have to give some type of health education. Okay, symptomatic treatment we have to provide it to the children. Okay, this is regarding medical management for the children who are suffering with the glomerular nephritis. Okay, next we are going to discuss about nursing management. This is the crucial care for the children for improving their health. First of all, we should maintain the intake and output chart. Why? Because the child is having the one problem like decreased urine output, no? Okay, completely decreased means absence of urine, anuria is there means the child not live normally. Okay, the child having the some complications. For prevention of complications, we have to maintain the intake and output chart. Okay, we have to monitor how much ml of water the child will be taken, how much ml of urine the child excreted. Okay, for identification or for differentiation, we have to maintain the intake and output chart. Okay, next we have to check weight of the children. Okay, why? Because the child having rapid weight gain, no? Okay, for identification of that problems, what is the reason why the child improving their health, weight? Okay, for eating more or for retention of fluid in the body. Okay, what is the reason for weight gain? Okay, regarding that we have to maintain or we have to measure the weight of the children. Next we have to check the vital signs. Why? Because the child suffering with the or showing one symptom like hypertension, no? For control of hypertension we have to check vital signs. Next another one is the we have to give health education regarding food. Okay, what diet the child will be able to take means we have to provide which food is carbohydrate rich. Okay, carbohydrate richest food should be provided to the children, and restriction of salt diet. Okay, who are suffering with the renal problems, for control of these renal problems we have to restrict the sodium diet or salt rich diet. Next we have to provide complete bed rest to the children. Next another one is the once the child will be excreted urine means what is the color of urine, what is the smell. Okay, sometimes pus cells is there, no? Due to pus cells the urine will be having some bad foul smell. Okay, is there any problems in the urine, that will be identified and that information will be give to the physicians. Why? Because the physician will give proper medications for control of this infection in the urine. Okay, next another one is the we have to encourage the children for a decrease or low fluids intake. Why? Because the fluid will be, once the child will be taking fluid means large amount of fluid accumulated or retained in the body. That's why the child having the increased weight. Okay, for maintenance of normal weight, for decrease of normal weight, for prevention of other complications, we have to give low fluid intake. Okay, next another one is the health education. We have to provide the children for follow-up care. Okay, routine care for improving their care, for improving their health status. The child will be follow up the care, means the physician will give some type of visits. Okay, first visit within 1 week, second visit or 2 weeks, okay, or every 15 days or every 3 days in a week. Like that the physician will give some type of visit or follow up care. Okay, whatever is mentioned by the physician as a patient for improving their health, compulsory follow up that visits. Why? Because in that visits the physician will give some medications Okay, what is the process for using that medications? Okay, regarding that we have to provide good health education to the children. Okay, next we have to improve the hygienic care of the children. Okay, why we have to improve the hygienic care means in the children's having the any poor personal hygiene means due to that the infection may be increased. Okay, if the child is not following hygienic care means the organism may be entered into the human body. Okay, there will be increased severity of infection. Okay, for control or for preventing infection we have to improve the hygienic care of the children. Okay, next last one, that is the emotional support. Why? Because the child not excreted urine or not providing urine means the mother will having the so much of tension, fear, anxiety. Why? Because my children or my kid not providing urine. Okay, what is the problem? How the problem will be cured? What is the better treatment for control or for preventing the health problem? Like that the mother having some type of tensions, emotions. Okay, as a healthcare provider we have to give some emotional support to the mother. Next another one is the last step, that is the complications we are going to discuss. Okay, in that complications what is means due to the acute glomerular nephritis. Okay, the child may have one complication, that is the acute renal failure. Okay, in that kidney nephrons is there, glomerulus is there. Okay, glomerular nephrons, they are giving support for functioning of purification of blood, formation of urine. Okay, in these two cells not functioning well means the kidney will failure their function. Okay, this is the one reason or one complication regarding acute glomerular nephritis leads to acute renal failure. Okay, another one is the anemia. Okay, the child may prone to get low hemoglobin percentage in the body. Due to that anemia may suffer. Next another one is the child having the growth failure. Okay, it is a one type of childhood disorder, no? In the developmental stage proper hemoglobin, proper blood percentage is not there, proper food is not there, the food not digested or the waste products not excreted as like urine. Okay, sometimes some problems is there means the child not having proper growth according to their age. Okay, this is also one complication regarding glomerular nephritis. Okay, next another one is the hypertensive encephalopathy. Okay, due to the excessive blood pressure the child may have the problems in brain. Okay, next another one is the CCF, congestive cardiac failure. Okay, due to this glomerular nephritis one complication, that is the heart failure. Okay, next another one is this acute glomerular nephritis. In early stages we are not identified, we are neglected, we are not giving proper treatment for control of streptococcal infection. In early stages means it may be leads to chronic glomerular nephritis. Okay, these are the complications regarding acute glomerular nephritis. Okay, thank you everyone.